I'm going to present a Pemphigus vulgaris case. A patient is 65 years old, male. He is Middle Eastern in origin. He has a history of hoarseness. His problem started with hoarseness of the voice for about 2 to 3 months, which remained undiagnosed. After those 2 to 3 months, he started to get mouth erosions and ulcers, so he suspected it to be Pemphigus vulgaris. Then he investigated with histology, with a biopsy, and it was confirmed that it was Pemphigus. Also, a few weeks later, he developed few small bullae of the scalp and the chest. So, as I said, the diagnosis was confirmed with the direct and indirect immunofluorescence, which confirmed the diagnosis of Pemphigus vulgaris back in April 2007. The treatment started with 75 milligrams of cortisone, which was equal to 1 milligram per kilogram, as he was 75 kgs, and until he continued with that treatment and that dose until all his lesions were healed, and that took around 6 weeks. Then the dose was reduced gradually over the next few weeks until it reached 40 milligrams. Then he went through further reduction until he reached 20 milligrams, but then they added 100 milligrams of Imuran because he was starting to get some flare-ups. So those flare-ups were managed mostly by increasing the dosage of Imuran or adding Dapsone or adding minocycline. So over the next few years, this is how he was handling the flare-ups that used to come, by either adjusting the dose of a cortisone or by adding one or multiple of these medications. So his current chief complaint is that he feels he's tired of all of this steroids in his body for more than 10 years now. And although he is controlled with meds, but sometimes he does get occasional flare-ups, and the lesions are mostly in the skin, superficial, so he's kind of more diagnosed now like Pemphigus foliaceus. So currently he is taking cortisone 10 milligram daily in the morning, and he is taking methotrexate 10 milligram once a week, and calcium and vitamin D, because we know the effects of steroid on the body, that it can lead to osteoporosis, so he is keeping a good calcium and vitamin D intake. In terms of surgery history, he has a cataract eye surgery due to the side effects of cortisone 3 years ago. But now he has perfect vision and he has no problem with his eyesight. In terms of social history, he thinks all this problem has come after the Iraqi war, because back in 2003, he was in Iraq when the war started, and it had a tremendous effect on his stress level and his anxiety and depression, because he needed to leave his country and to leave everything behind him, and he felt, because of all this extreme sadness and anger and stress, he started to develop this autoimmune because he never had this issue before. But now he has moved to Dubai and he is stable, but of course he cannot get out of the medication still. Intraoral examination shows large facets on all the teeth. Midlines are off center. He has mild crowding and mild gingivitis, but no intraoral lesions or ulcers. Extraoral examination shows that some skin vesicles are there and they are crusting, mainly in the scalp, as we can see in this picture. It is very clear. This is part of his head. He's bald in general, but this is on the side of his head. You can see the crust of those bullous. After they kind of heal, they make this crust on the scalp. There is no signs of eye involvement though, and this lesion on the scalp is not painful. So the diagnosis would be Pemphigus fallacious or Pemphigus vulgaris due to his previous history. So the plan was to refer the patient to his physician or dermatologist to decide on the efficacy and appropriateness of using the biological treatment, because the patient came and he was seeking other alternatives. So we recommended that he follows up with his physician to see what is appropriate for his age and for his condition in order to start that new medication. In reviewing the literature about the rituximab, rituximab is a monoclonal antibody. It directed against the CD20 antigen of the B lymphocyte, and it has demonstrated to be effective in various autoimmune diseases, and among them was the Pemphigus vulgaris. The most common protocol, I looked a lot about the perfect protocol or the common protocol of what is the dosage and the cycles of taking rituximab. I found that there are different studies with different cycles or protocols, but the most common I found was that they take one cycle of 4 weekly injections of 375 milligrams. Although it's a good treatment, but there might be still a relapse chance after remission, which can be treated with either low doses of immunosuppressants or another cycle of rituximab. Also, at that time, we might consider the IVIG treatments in combination with rituximab, as it showed to have promising results for some patients. Further looking into the literature, I found this study by Wang et al. In 2015 that looked at the efficacy of rituximab for pemphigus. It was a systematic review and meta-analysis, and they found that usually the high dose of rituximab was associated with longer duration of remission, of complete remission, compared with a low dose of rituximab. However, the choice of the optimal regimen will depend on the overall condition of the individual patient. Another look in the literature, it found that when systemic steroid and immunosuppressants are contraindicated in some Pemphigus vulgaris patients, a combination of rituximab and the IVIG therapy can produce a prolonged sustained remission without additional systemic therapy. Now the patient went ahead and he tried to take rituximab. Of course, it was expensive and he had to really arrange it to get it from India, actually. So the patient took 2 doses of rituximab around 6 months ago. But honestly, he informed me that he didn't really feel that it has done like magic. For a while, he was able to go down to 5 milligrams of steroids instead of 10. But sometimes he does get flare-ups and he goes back to his original 10 milligrams. So he was really hoping to get rid of the steroids and the methotrexate in particular, but unfortunately he didn't find that those 2 doses were enough. Probably he needs more. He didn't really stick to the cycle of 4 weekly injections because he couldn't afford it, or he wanted to try out first 1 or 2 and see how it goes. So my recommendation would be to really maybe do a full cycle again, a proper one, and check with his physician about the dosage. Maybe a higher dose will also be a good one. But overall, at least he didn't have any major complications with it. And hopefully, if he do it again, he might have better chances for less medications. And that's all. Thank you very much.